Welcome back, and thank you so much for joining us for another installment on KMOX, our Black History Month series that I am lovingly calling Living History, because there are those among us, walking among us in 2023, who are still making history, and she is one of them. She is the first Black woman to head the St. Louis Health Department. The city of St. Louis in St. Louis, Missouri, has never had a Black woman at its helm, and our next guest has broken that ceiling, has become a part of the history books as we speak. She is Dr. Hlatshwayo Davis. Thank you so much. It's so great to see you again.
It is wonderful to see you, Carol. I'm so excited to be here. It is, it's phenomenal to be able to say I'm the first Black physician, female, to ever take this position. It's especially exciting because I think I'm also breaking records in infectious diseases where you don't see women like this. But I will say that Dr. Melba Moore, who preceded me, opened this door. She is also Black history. She is a predecessor, a mentor of mine, a giant who saw the city through many, many things as well. And so for me to come in now and to provide this example as a Black woman in a Black woman physician, as a Black woman in infectious diseases, of which there are not that many of us, is truly an honor for me, and it's something I take very seriously.
So let's be clear then, Dr. Melba Moore was what, and you are what? And
so she was.
Both are history makers, but in what way?
Yeah, I'm glad. Let's I want to share that platform because, like I said, she opened the door. She was a health director for the city of St. Louis. Went from, I think, a commissioner then to a director. But I'm the first physician woman to have the title after her. I think she was 2 directors back. A visionary, tough nuts. She was known as a very difficult, to say it as it is. But when I tell you, one of the kindest, cares about public health, didn't have to, lived in a whole other state when I took this job. I had no orientation, no one to really help me assume this position. And I was a physician who did clinical practice, right? I had never been in local government. I didn't even know how to manage politics. And she said, I will help you. She put on her calendar twice a week, every week, to meet with me, to orient me, to mentor me. So that is a queen, a true queen, and who opened this door for me.
And so she, a physician as you are, but you're the first talking
She wasn't a physician. That's why I'm the first Black physician.
Got it. She was PhD.
She wasn't a physician. Yeah.
She was a PhD.
PhD, exactly.
Got it. Okay. So, people, we have these questions, and we are still learning to this day what means what and why.
That is it. And it's okay to ask, and it's okay for us to celebrate each other. I call it diversity and excellence. One of the things that systemic racism and systemic, institutional racism has done is say there's only one way and only one set path that's nonsense, right? Diversity is so beautiful because it provides us with a diversity of excellence. So Melba Moore is and was excellent. Hlatshwayo Davis is and was excellent, right? All of these people that have paved the way have, and we can all celebrate each other and share each other's flowers in this amazing way.
And so then talk to me as one who was in private practice.
Yeah. Why
you took this leap then, not only to go into government, city, but into politics.
Yeah. So, that would have to start from my upbringing. I was raised in Harare, Zimbabwe, the child of a veteran who was instrumental in us getting our country's independence. My mother, fierce, the first flight attendant from then the newly independent Zimbabwe, and always dreamed of providing for my family. I lost my father at 15. Very suddenly, and I remember being a young child thinking, wow, I hope his physician, who was the only person he confided in around his condition, he did not confide in his family, he was divorced from my mother, lived in another country from us, so we did not get a chance to say goodbye to him when he died. And I remember that being the spark of, I want to be in medicine, and I want to be the sort of provider that provides comfort to someone like my father in his final days. I then also lived in a time where HIV was becoming this big, prominent, devastating epidemic. And in a country that was one of the top 3 countries for HIV deaths, wiped out much of our working class, created orphans, old people taking care of orphans because their parents were dying. And so that was really the reason behind wanting to be a physician, the death of my father, and specifically infectious diseases, watching how HIV devastated my country. And when I started clinical practice, I went to Cleveland Clinic. I spent 10 years in Cleveland, Ohio, training in medicine and in public health. I knew that the best way to impact the communities I care about, Black and brown communities that have been left behind because of systemic and institutional racism, that public health was going to be as important as a degree as my medical degree. And so when I met my hunk of a husband during medical school, I followed him to St. Louis. He was doing his residency in pediatrics. And I was at WashU in infectious diseases. And I just didn't see people who looked like me, who cared about the things I cared about. I didn't see academia sort of celebrating people who did what I did in an obvious and equitable way. And so I took a contract out of fellowship, a partial contract with the Veterans Hospital. And that opened my eyes. Seeing all of the social and structural determinants of health that plague our veterans, that are very similar to what I see in North St. Louis and parts of South St. Louis, where you see Black and brown people disproportionately suffering from high blood pressure, diabetes, and a whole cancers and a host of other things. That's where the emblem for public health really grew, and I was able to lead as the lead HIV clinician at the VA. And then I saw this historic and impassioned woman in our mayor, Tashara Jones. I saw her come to the fore, and it was community leaders who respected what I was doing in the community. I was educating folks in the community. I was the chair of Fast Track Cities, which brings together community groups and the local government. And they're the ones who said, we would like you to consider being the next director of health. I didn't even know that the application was even out there. And so it was them who really came to me, and the rest is history. Once I interviewed with the mayor and realized that her and my vision for public health were in alignment, I knew that it was time for me to step up and to serve. And what better time to have an infectious diseases Black woman immigrant as during the most historic and devastating pandemic of our time in COVID. At the time, I was a specialist, as an infectious diseases doctor. I did a lot around health equity in COVID, and that's really where I thought it was important for me to step up.
And so we'll talk about some policy issues here in a moment, but I do want to talk about you, the woman. I love it that you mentioned your hunk of a husband. You, the girl. When did the desire, and I know you talked about your father, but was there before that, was there a desire to be a physician, or were you going to be an astronomer? Were you going to be a designer? What was on your mind as a young Mati?
As a young Mati, a young immigrant halfway across the world, I watched Oprah, and I said, with this mouth, with this personality, I was going to be the next Oprah. And I used to say, I'm going to meet her and I'm going to tell her that when she retires, she can just pass it on to me and it will work great because it will go from being Oprah to Mati. And that was the dream, and medicine wasn't even on my radar. I was a communicator, an empath. I love people. People would have guessed that I would be an author. I love to write. I remember my English teacher saying that I wrote in the style of Jane Austen. People would have thought maybe I was going to be a lawyer because this mouth just didn't stop, right? But again, when that type of trauma you experience from your father, who wasn't very present in your life, who was a veteran himself, had a lot of the same issues that our veterans face here in the United States of mental health and trauma that isn't addressed, right? And so was a wonderful, kind human, but not a great dad. When he died, it devastated me because I didn't have a chance to say goodbye, to repair that relationship. And that is really what changed my entire course to medicine. That is who Mati the girl is. She was a sister. She is a sister. I'm the oldest sister of 3 vivacious, in total siblings. I have 2 siblings. My sister's a lawyer, my youngest a brand strategist. But the hero of my story is my mother, a powerful Black woman who, as a single parent in a culture that shunned her for it, right, and judged her for leaving my father. She is the hero of my story. She taught us that education was everything. The first big gift she ever got us was a bicycle, and we were so excited because we thought it was a toy. And she said, no, you can only use it to go two places, school and the library, and handed us a library card. And she taught us that education was going to be our ticket to the world and our ticket out of, potential poverty. And so my mom is truly the heroine of my story.
It is my dream. My husband as well, who is from the U.S. Virgin Islands, both of us want to go to Africa. And so many of us as African Americans have no connection because the culture, the history was demeaned, diminished, robbed, cut off from us as the descendants of slaves from Africa. So I'm just dripping with anticipation to hear what life was like in Zimbabwe. You told me that you just took your children there for the first time, and tell me how old they are, but talk about what Zimbabwe is like. And
I mean, you make plans and God laughs. My whole desire was to come to the United States for an education that I could take home to my people. And I met my beautiful best friend, soulmate husband, Dr. Jesse Allen Davis, new CMO and VP of strategy for IHN, and also on staff as a pediatric hospitalist in the NICU at Washington University. And we met, and that changed everything. He's my family, and we made a family here. But the plan was always to go home and help my people. And because of that, our children have predominantly been here. Because of the pandemic, because of work, because of political issues, the children had never been to my country. And so thankfully, we were able to get my mom here to visit, but only once a year. So to have my two children, Aneni, which means God is with me in my native tongue of Shona, and Naniso, which means miracle, because she's my pandemic baby. I had her in May, right at the beginning of the pandemic. She's 2.5 now. So they went home for the first time. And I think Jesse and I should get a little credit. 21 hours on a plane with 2 kids, 6 and under, is not a game. But they did so well. It was watching them be barefoot running in the backyard. It was them climbing trees and rocks in the way that I had seen them. It was them connecting with their cousins. It was them eating sadza and all of the different things that I grew up eating from my mom's kitchen. It's healing, right? And it's what I want for every Black person who are descendants of Africa. It is to put aside this ridiculous notion of division because of what colonialism did to us and our people, and the decisions that were made as a result of colonialism between Africans and now African Americans. It is for people to come home and to their roots and to be able to experience the beauty of our melanin, the beauty of our majority, the richness of our culture, the kindness and joy that comes with that sense of pride and ownership in the most beautiful continent on earth. It's something I take great pride in, and that I encourage all of my friends here and family to prioritize being able to travel there if they're able.
We my I have 2 sons, and they're now adults. It's 23 and 26. He'll be 27. And I remember my soon to be 27-year-old was asked by a teacher. The class was asked to create a map of their ancestors. And I emailed the teacher and I said, all we know is the continent. We don't know.
That's right.
We can't say. And I thought, she should know better. She had a number of Black students. And so we did what we could, right? We look at the continent, we looked at food, and we looked at the number of languages, and a continent, right? But I felt for my son then, as I always felt for myself. What was robbed means I'm a victim, but I'm not a victim, right? But I am a victim.
Yeah.
Because my culture was robbed, and I don't know who I was, who we were. I don't know, but I know enough. Do we know what? I know people have studied this. like, what does it mean to have had so much a part of our identity, distinct identity, stolen like that, diminished like that, and what it's meant for us? We talk about trauma, and now we talk about trauma, right?
It's just deep, distinct trauma, and it is violence. And to be in a political climate where that is now trying to be robbed from us in the halls of education, speaks to the fact that the downstream impact of colonialism continues to this day. The fear of allowing people to be who they are authentically, to know who they are. White supremacists know and understand deeply that once Black and Brown communities have that sense of belonging, of knowing, of community, that it is a threat. It is a threat to what they hold so dear, which is complete and utter dominance, right? And so for me, I will fight for it as a part of public health, even as a director of health. I was very honest with the mayor when I interviewed with her that everything I do is centered on health equity. And the notion and the knowledge, because I trained for this, so I know that there is a lot of data that proves that Black and Brown communities back from slavery to current day, right? It's not just historical, it is present, have a disproportionate morbidity and mortality, right? So disproportionate illness and death. And I will not stand by it. And so the work of this office, the work of this department, is to lead and to provide for the most vulnerable. We saw that during COVID, what it means to have the advocacy that happened from many folks like myself around health equity, and how all of a sudden things that we'd never seen before, $6 billion being pledged to federally qualified health systems through ARPA funds, through other grant opportunities, and direct federal assistance. We saw all of a sudden that these things were possible, and so why shouldn't they continue past now? And so this is something that I'm very passionate about across the board, because we see how that violence, how that trauma historically continues to current day, right? And how it impacts our communities, and has now created so much health illiteracy, such little understanding in public health and health in general in our communities. And how I can show you here in St. Louis, in my epidemiology department, I had 2 epidemiologists when I joined. I've grown this to a team of 10 people, because I do believe that data is justice, and that it informs policy and funding, as my good friend Dr. Corey Bradley always says. And so it is important for us to use those statistics, the statistics that say the same people in North St. Louis and parts of South St. Louis disproportionately are impacted by COVID, disproportionately are impacted by high blood pressure, disproportionately are impacted by diabetes. That cannot stand. We must do and be better.
But that the opposing viewpoint, or a different viewpoint, is that it's our fault. Mm-hmm. Like I'm 5'4" and I weigh too much. It's my fault. It's my behavior. It is not, because there's ongoing debate about whether systemic racism is a real thing or not.
Absolutely, and that's the excuse, right? But if you think about historically, the fact that Black people were moved through colonialisms to lands that were not agriculturally favorable, were not provided with the same resources. If you bring that to current day and look at how just geography, maps, inner cities versus thriving rural and urban settings exist, and the disproportionate, again, structural and social determinants of health, the ability to people to access transport, nutrition, and a host of other structural and social determinants of health directly impact health. It is an absolute lie and a fallacy to say that it is on an individual when you have stripped them of every available resource that other communities have to thrive, to be healthy, and to ultimately be successful.
Who mentored you? And I ask that because we hear so much about the training of physicians, that there are fault lines even in the training, and that it's changed, of course, certainly over the decades, but did you have mentors that have been able to help you to be the Dr. Davis that you are today?
Listen, Carol, I have to be very honest that it's a difficult and a conversation that must be had. I was trained at some of the finest institutions in the nation, the Cleveland Clinic, Case Western Reserve, and most recently at Washington University. Having said that, I experienced a lot of trauma, a lot of difficulty because I was one of the only, right? One of the first two Black people for the new Cleveland Clinic Medical School. One of the only Black residents at Case Western, and certainly one of two only Black fellows at Washington University. And when I joined the staff of my division, the only Black practicing physician.
And you're a young woman. That's
not that
long ago.
I am young, and it's 2023. We shouldn't be having the Black first anythings, right? So I did not easily have access to the same resources and the same level of mentorship, and more importantly, sponsorship. People love to harp on about mentorship. If you arm someone like me with mentors who don't have access to leadership opportunities, to grants, there's no forward momentum, right? But when you have sponsors, people who just by who they are in their institutions, the fact that they can provide you with opportunities, with advocacy at the highest level, it changes everything. So I had mentorship, but not sponsorship. And the road towards advancement and promotion was not equitable for Brown and Black people, in my experience in academics, that honored traditional pathways of basic science and clinical research. For someone like me, who brought principles of diversity, inclusion, equity, and of community engagement, and ultimately public health, that wasn't a visible pathway, neither was it an easy one. It was lonely, it was disheartening, and it made me, quite frankly, feel like I didn't belong and I was a failure. And so I sought those people out, and I'm so fortunate to have built a cohort of both mentors and sponsors later in my career. Dr. Alvin Gang, Dr. Jasmine Marcellin, the George Counts Interest Group, which is the organization for Black physicians within my society and in the Infectious Diseases Society of America. These are the people who helped me, who propped me up. And when I was brave enough to say, enough, I'm going to step away from a system that does not honor who I am and does not ultimately support who I am, who said, you will be okay, your career is not over. And so working at the Veterans Office, and now breaking records and barriers in being the first Black female physician director of health for the city of St. Louis, and one of the only infectious diseases directors in the country, is something that happened because A, I was brave enough to say I am worth more and I should be valued more, and B, because I had this group of mentors and, more importantly, sponsors who were able to support me along the way. But the OG mentor is my mom. She is the one who prays for me when I'm too weak, who reminds me who I am, and who's encouraged me since day one.
What would you tell your younger self now? And I don't want to pick an age for you, but
have more fun, laugh more, and don't ever let anyone make you forget how incredibly beautiful, valuable, and important you are.
As Black women, because I've got the mouth for sure, and I've been told that. I've been told I'm loud. I've been told that when I speak, other people shut down and maybe I should just lay back. I've actually been told that. How do you navigate that as a Black woman who clearly is strong and powerful, educated, dynamic, reaching for excellence, and yet, we have these landmines, if you will?
I'm unapologetic about who I am. I remember the first time I was on a major network as a medical contributor during the pandemic. I used to be a medical contributor for BBC, CNN, Al Jazeera, and a host of other networks prior to me taking this role as a respected infectious diseases specialist and health equity person during COVID. And I remember a producer sort of in all good intention telling me that for these networks and for live TV, we prefer people who wear their hair back straight and wear pastels, and that's sort of what is accepted. And it was then that I said, no, I am here for representation. I am here so that we don't see the same old white men on our TV screens, so that people in my community can see a Black woman immigrant who looks like them, who sounds like them, who is excellent, who is an expert in her field. And she will have a fro, she will have bantu knots, she will have braids, she will wear a print every time she feels like it, and she will still be, yet and still be excellent. And the second thing that I've done is surrounded myself with like-minded Black women and allies who celebrate me in my full authenticity, scars and all, right, flaws and all, and who encourage me to continue to be the best that I can be and to grow in this role. And so I don't look for yes people. I look for people who will love me and protect me, but tell me the truth and tell me when I'm wrong. And I think that that approach, being unapologetically me and surrounding myself by equally strong, loving folks who hold me accountable, has been the key to my journey.
I can't let you go without talking about this increasing subject matter discussion, and that is the connection between health and health outcomes and violence and crime. And that I would include in that gun violence. Of course, there's been a resistance to call gun violence a health crisis by some. Talk about where your mind is when it comes to making those connections and changing the narrative and therefore people's lives.
So let me be very clear. The CDC has declared gun violence a public health crisis. They have declared racism a public health crisis. And I would add that we should be declaring mental health a public health crisis. And all of these crises are interconnected in very real ways. It is embedded within public health and it's important for us to prioritize gun violence as a priority. The mayor has done so. She has supported me when I said that we needed more resources and leadership around gun violence, and in a historic fashion, opened the first office for violence prevention here in the city. My good friend, Director Will Pinkney, oversees that, and both public safety and public health come together to address gun violence here. And so that model is a model that should be across the country and that needs to grow. But because of the political issues around accepting that gun violence is a public health crisis and a crisis in general, we have a long way to go. And we need to understand how it impacts our communities, the generational trauma and the subsequent mental health impact, which is why I am the first director to open a Bureau for Behavioral Health last year, that we are hiring for currently, that I have also brought in a team of CDC specialists to lay the foundation for through June of this year. As we are hiring, as you know, hiring is very difficult in civil service. It takes a long time. Salaries are not as competitive. Thankfully, I work for a mayor who's trying to address that. But in the meantime, that is the work that we're trying to do. So you are seeing very real action that we don't get a lot of credit for. People love to complain about what the city's not doing, but I don't hear a lot of people applauding the fact that we've opened this Office of Violence Prevention and that the mayor saw it fit to do so. And that, you know, under this director, we now have a new Bureau for Behavioral Health, because again, these things are interconnected and will continue to destroy our communities if we do not make them very real priorities.
What is, last question for you, two things. Something about you that we don't know, and unexpected. What's unexpected about this new phase of your life?
So what's unexpected about this new phase in my life has been the level of toxicity that civil servants face. I came into this role thinking, oh, I'm going to focus on my external priorities, right? All the things I was going to do for community. But when I met my staff, they were so burnt out and feeling devalued, and from leading the city through the pandemic, but also being public health workers that are grossly underpaid nationally, and who could easily get double and sometimes triple their salary if they went into private practice. And so it is an absolute failure of this country to not prioritize public health and to not pay heed to the very clear data that links public health to a strong and vital economy, right? I am 1% of the city's budget, and that is what this mayor's office inherited. The WHO says the bottom threshold should be 5%. So we have a long way to go to really reversing health illiteracy, prioritizing public health, and understanding that if people are sick or dead, they can't work, they can't fix the streets, they can't be good cops. And so we need to prioritize public health much higher than we have. And then one thing people don't know about me is I am a fierce mom first. I love my kid. I feel like I was put on this earth to raise these two beautiful baby girls. And I appear to be very strong and very cutthroat, but when it comes to my babies, that's it. They have my heart. Also that I love to write. I think I'm going to probably publish a book before I die. I'm a writer first. I came into medicine out of passion and necessity, but I am a writer and an avid reader. And so hopefully at some point people will be able to read something that comes from my pen.
I see the book club. I see it. And maybe Oprah chooses your book and it's
Come on. Do you see this full circle moment? Do you see it?
I do.
Okay.
I see it. I feel it. I want it. Absolutely want it. Doctor, did you tell us what Mati means?
Matifadza means you have made us happy or joy. And my late father's name was Gaylord. And so he thought he was going to have a son and he got me instead. So he called me Gail to honor his name when I was born. And Gail means source of joy. So I truly believe that that's my calling as a physician, as a public health expert, as your director of health. My ultimate goal is to bring joy to people's lives as they traverse some truly horrific and difficult health and public health concerns. I love people. I love the city, and I love our community. And I am so honored to be someone that you would consider as living history during Black history. You are living Black history, and I want to thank you for your leadership and the platform that you provide for responsible leadership throughout your career. You are beautiful inside and out, and we honor and celebrate you too.
Well, I am so touched by that. Carol means song of joy. And so, when we first met, we were like kindred spirits, baby.
Kindred. It was on site with us.
Yes, it and it will continue to be.
Yes.
Whatever you're involved in, I want to be a part of, and however you may need me in the future to lend my voice, my time, my talents, my gifts. I want to do that for this great city and for its people who deserve to know that their lives are worth it. Their lives are worth a great deal more. And I want to deliver that message in any way that I can to lift us all.
Thank you, Queen. I truly appreciate that. And I know that's real about you. I will take you up on that offer 1,000 times over and just ask that in return you hold me accountable. The good, the bad, and the ugly.
There's no ugly girl. No.
I know that's right.
Not receiving that at all. I blocked that.
I know that's right.
I dodged that. There's none of that. She is Dr. Hlatshwayo Davis, the first Black woman physician to lead the St. Louis Health Department. Dr. Davis, you are truly, truly living history. It has been my honor.
Thank you.
All right, we shall stop that and send it to the